Insurance issues in the ACA. Giving descriptive information regarding the ACA program and using epidemiological data, we can show how the target population, age, ethnicity, all determine how successful the Affordable Care Act will be in the future. Epidemiology assessments will guide the overall outcome to the healthcare coverage issues. Only after understanding these issues can we offer some assurances how we will ultimately attempt to solve these issues. The vulnerable population of America includes mothers, children, and teens, abused individuals, chronically ill and disabled, those with HIV and AIDS, people with mental conditions, people affected by alcohol and substance abuse, indigenous and homeless people, and minority and ethnic groups that involve the very young to senior individuals. Healthcare disparities differ among these groups due to lack of insurance coverage, accessibility to healthcare, quality healthcare, the proximity to healthcare, and limited income to pay for medical treatment. These factors indicate that our target age is between the ages of birth to Medicare of all individuals in the United States. As the Affordable Care Act impacts all of these individuals, especially those with special medical conditions or special economic or cultural conditions. The United States is the only industrialized nation that doesn't provide health care coverage for all of its citizens. Despite repeated attempts to expand health care coverage, approximately 46 million Americans lack coverage. Health care insurance facilitates access to health care, preventative care, and helps protect against the high cost of catastrophic illnesses. Due to these needs, the Affordable Care Act was enacted to provide health insurance coverage for Americans who are at a socioeconomic disadvantage and vulnerable population groups who can be found in every state. A census study taken by the Institute of Medicine confirmed that an estimated 18,314 Americans between the ages of 25 and 64 die annually because of lack of health insurance. This is comparable to the death due to diabetes, stroke, or homicide in 2001 among persons aged 25 to 64. There are many social and behavioral determinants that affect those vulnerable groups who lack health care benefits. They are policymaking, social factors, health services, individual behavior, economic, biology, and genetics. Social determinants reflect the social factors and physical conditions of the environment which people are born, live, learn, play, work, and age. These involve the resources to meet daily needs such as education and job opportunities, living wages, or healthful food. It is included the social norms and attitudes, exposure to crime, violence, and social disorders, social support, and social interactions. There is exposure to mass media and emerging technologies, socioeconomic conditions, which include poverty, quality schools, transportation, public safety, and residential segregation. These determinants impact a wide range of health functioning, and quality of life outcomes. Both lack of health services and quality health care is a determinant that impacts health. Lack of access or limited access greatly impacts an individual's health status. A person who doesn't have health insurance is less likely to participate in preventative care and possibly delay medical treatment. The barriers to accessing health care include lack of availability, high cost, lack of coverage, and language barriers. These barriers may lead to unmet health needs, delaying in receiving appropriate care, inability to get preventative services, and prevention of hospitalization. Individual behaviors are also another determinant that affects people who lack health care insurance. Each person plays a role in their health outcome. Many public health and healthcare interventions focus on changing individual behaviors such as substance abuse, diet, and physical activity. A positive change in individual behavior reduces the rate of chronic diseases in the country. Biology and genetics affect specific populations more than others. It is known that senior adults are biologically prone to being in poor health versus adolescents due to the physical and cognitive effects of aging. There are various ethnic groups who are genetically prone to specific diseases based on inherent ancestry. These Biological factors are determined by age, sex, sexual orientation, and family history. Policy making involves policies at the local, state, and federal government level that affect individual and population health. Some policies affect the entire population over extended periods of time while simultaneously helping to change individual behavior. The existing policies dealing with the ACA are as follows. The main concern was that no discriminatory practices were involved. Public health has always been a major concern, but also the protection against an increased cost of health care. No discriminatory policies of third-party payers. Arbitrary discrimination that limits full reimbursement. Starting September 2010, insurers are no longer allowed to deny coverage to children younger than 19 due to pre-existing conditions. There are policy development ideas set in place and future endeavors, outlines of care that are expected to be followed in accordance with the Affordable Care Act. A primary care practice can use this model to allow patient-centered medical homes or accountable care organizations. Policymakers took note on the potential of guided care models for the ACA of 2010. Medicare and Medicaid centers are tested to ensure successful new payment and service delivery models. With new development, vast improvements were made to quality of patient care, caregiver perception, quality, reduce the use and cost of expensive services in well-managed systems. Two major goals of the Affordable Care Act is to provide the uninsured and underinsured within the country health insurance and to lower the overall cost of health care. There are a few stakeholders that have personal opinions about the overall policy and the success of the ACA. Dr. Brian Klepper, the CEO of National Coalition on Health, is pleased with the outcome of the law since it has helped many uninsured Americans gain access to health care. Dr. Paul Markovich is the president and CEO of Blue Shield of California. He explains that the ACA has done what it was enacted to do. Now more than ever, lower and middle socioeconomic classes have access to health care. Margaret Murray is Chief Executive Officer of the Association for the Community Affiliated Plans. She is glad to see the progress that the ACA has made. Uninsured rates of the nation are going down while the medical insurance premiums have not skyrocketed. Greg Zigdor is President and Chief Executive Officer of the Arizona Hospital and Healthcare Association. He explains that the policy has done wonders within his state. He also does not see how the ACA will sustain itself long term. It is whether the act will trigger real reductions or control in our level of healthcare spending, and if it does, whether these costs are positive savings related to real improvements in care or just government or private sector price setting. These stakeholders were chosen because their political affiliation aside, they were truly unbiased of the law and its purpose, which is to grant health care to the uninsured and underinsured. They are subject matter experts in their field, and because they run such large healthcare organizations, they are able to see firsthand the pros and cons of the ACA. Policy development is important to the Affordable Care Act because without it, there would be absolutely no improvement to the issues that may arise. Any policy that is made might not work out as well as the writers of the ACA wanted it to. Due to this, developing the policy is in order. However, there are three of the essential services that will help reveal to all the stakeholders how the issues are being fixed. Informing stakeholders that we recognize the issue and we will tell them how they are going to fix it. Next, we need to educate the stakeholders on the new policy in order to ensure it is enacted properly. Empowering stakeholders to have a voice or help change our healthcare system for the better is a wise idea, because when people feel as though they have no say in anything, they will tend to rebel. And finally, mobilizing community partnerships is vital, because if the healthcare organizations are able to get out into the community to assist them, the public will learn more about the ACA other than just what the news has revealed to them. The Affordable Care Act has had some serious challenges: laws and regulations, website issues, long-term problems with the U.S. economy. ACA will link people without insurance or inadequate health care, which until now has been a moral issue our country has faced. Enforcing laws and regulations by making sure the ACA expands coverage while slowing costs and increasing efficiency of the healthcare sector. Laws surrounding the ACA enforces policies from covering only those with high healthcare costs. ACA includes penalties for people who go without insurance. Businesses with 50 or more employees who do not offer insurance will also be required to pay a penalty. The ACA will provide assurance to those in the community to sustain the level of quality and effective care. This will be obtained by ensuring programs and medications are affordable. An expansion of the funds will allow a person on the program. The creation of new programs will provide personal assistance services such as the Community First Choice options. Research and new insights involving the ACA have had different approaches. Some consider the reform to be a healthcare crisis. Third parties are now paying at least 87% of healthcare costs. Here are a few solutions to the healthcare problem: changing the tax code, eliminating some state mandates, reform medical and Medicaid. Ultimately, the effectiveness of the ACA has been able to provide to the population has different reviews. There has been a decline in employer coverage. The number of uninsured Americans has been addressed so far. There has yet to be a decrease in out-of-pocket costs. At this point, 2015, some things are working out, but some are still a work in progress. Many small companies have found it cheaper to take the tax fine for not offering coverage to employees rather than offering coverage. As we get further into the implementation of the ACA, it should be possible to make it more appealing to offer coverage rather than paying. In conclusion, it is important to realize that the Affordable Care Act's main goal is to reduce the cost of health insurance while ensuring that all Americans have a chance at excellent quality care. While there remains uninsured individuals after 5 years and no visible reduction of healthcare premium costs, a little more time is needed before we see results. Not all aspects of the ACA have been implemented yet. Over the next 3 years, we may see more pieces of the puzzle fall into place. Once that happens, it should be possible to see the number of uninsured decline and the cost of premiums decrease as well. While Affordable Care Act is law, changes need to be passed legally or they will hold no grounds. The same goes for expanding the funding for the ACA. It must be passed legally. It is the duty of the United States government to ensure that we fulfill our promise of affordable health care and health care insurance for everyone. Without this, there is no point of having passed the ACA. We have a duty to ensure the passage of policy development so that improvement of health care can be realized. The ACA is solving community health problems by setting goal plans with coverage for millions of Americans, including families, employees, and Medicare and Medicaid beneficiaries. The ACA is helping people with pre-existing conditions by guaranteeing coverage by not letting the premiums vary based on their gender or medical history. Today's health issues include 36 million deaths each year that are caused by chronic illnesses such as cardiovascular disease, cancer, diabetes, and other chronic lung diseases. Solving health issues covering 70% of healthcare expenses. This is allowing people to have the proper care they need in order to better their health and needs. Developing plans for many individuals and families by allowing them to purchase health care insurance is what is best for their needs. Enforcing laws such as children being able to stay on their parents' insurance until the age of 26. Another law stating the insurance companies will not be allowed to drop coverage whenever a person gets sick is known as rescission. A third law stating that most individuals' business will be required to provide coverage for their employees, as well as individuals being required to get coverage themselves or they will get a fine. Covering pre-existing conditions, businesses are having to cover their employees. People participating in the program must pay premiums for 5 years in order to be eligible to collect benefits. Help paying for long-term costs with the elderly as well as people with disabilities. Doctors, nurses, and other healthcare professionals are the backbone of the healthcare system. The ACA supports and expands the nation's healthcare workforce. It gives each state power to recruit healthcare workers. The Act promotes much needed jobs in the healthcare industry to prepare for the future, thus creating jobs for American workers.